My name is Annie Diaz. I'm a licensed professional counselor, and I'm the mental health therapist with Montezuma County Department of Social Services. In deciding whether or not to come here today, I thought about Dr. Seuss. Unless someone like you cares a whole awful lot, nothing's going to get better. It's not. In preparing for this testimony, I felt the weight of all the challenges faced by our community on a daily basis. In Montezuma County, we are severely lacking in providers and programs to serve our increasingly high-need area. In addition to high levels of poverty, statistics from 2017 show that we have the 4th highest suicide rate, more than double the statewide average. In our community, we have the following resources to address these significant challenges. As been mentioned before, Access Health System. In Cortez, it's our only community mental health center. It serves the entire county. When I worked there, I frequently felt overwhelmed with an extremely high caseload and an inability to see people with enough regularity to make a significant difference. Furthermore, I was the only bilingual Spanish provider and tried to help anyone I could with not only their mental health needs, but also case management and medical translation. Providing adequate and culturally sensitive services to these individuals and their families will contribute to the stability, health, and progress of our community.
Hello, I am Emma Ann Harmon. I'm a suicide attempt survivor, a community member, and a Durango native. I am one of the lucky ones. I should not be here today. I'm alive and stable, and that is no small feat in the face of my mental illnesses, trauma, and chronic suicidal ideation. However, I cannot give the current behavioral health system any credit for my stability and improved behavioral health. A week later, I almost attempted suicide, but I knew I had a family to take care of, and I knew to seek immediate help, especially after my failed suicide attempt in 2014. I knew I needed to get help right away. So I walked into Access Crossroads Crisis Center at 5:15 p.m. with severe and intense and active suicidal thoughts, and was released within 45 minutes because the crisis therapist did not believe I would harm myself. Or maybe he just wanted to be done with his shift so he could leave at 6. Regardless, I was released and unstable and not okay. Thankfully, I have a wonderful support system in place, and I had the strength and knowledge to reach out for help again later that evening. 3 of my friends stood up at my doorstep within 30 minutes and sat with me to make sure I was safe and create a safety plan with me moving forward. If I did not hold the privilege I do hold, and I had to solely rely on the current behavioral system, I would not be alive today. But like I said, I am one of the lucky ones.
We have a 12-year-old son who has diagnosed behavioral and emotional needs. I'm just going to use an analogy since this is Durango. We have a lot of river rafting companies here. And when you book a rafting trip, you get a helmet, a life preserver, a paddle, and you're told how to work with that river guide to navigate the rapids and to get downstream successfully. Well, in that analogy, I would say we were given none of those things. We were kind of just shown to the river, given a hope and a prayer, and cast upon our wits and our ability to yell for help to anyone on the shore to see our need.
I will never forget when I looked to my husband and muttered, "I think our son has a mental illness." We were desperate to find Andrew help immediately. As we blindly navigated our way through our local and regional options, we realized this is going to be an out-of-pocket experience, as many mental health providers in our area do not work with private insurance. As Andrew became more stable, we were able to regroup and really focus on what we needed most as his caregivers: support. Not only for ourselves, but for our community that seemed to be quietly struggling as well. In 2019, Beacon of Hope Durango was founded by me and my husband, Phil. Our heartfelt mission is to provide a safe place for caregivers, families, and friends to support each other and share in their experience with mental illness. My husband and I craved moments of sharing challenges and successes as a parent, and we felt confident enough with our journey that we may be able to share and provide solace for even just one other parent experiencing this.
The patient in question that we're talking about today is a 14-year-old Hispanic female who was adopted from the foster care system. She has struggled to engage in previous years due to high turnover of providers with Access Health System. The patient would have really benefited from the RYFS program, but keeping that position staffed has been challenging. The patient has attempted suicide twice in the past 9 months. Both times she was taken to the ER and evaluated by Access Health System crisis team. Both evaluations resulted in a safety plan with the mom of client,